One of the most rewarding experiences as a music therapist at the Children's Medical Center is the relationships that I'm able to create with young adult patients and teenage patients. I often describe two methodologies of walking into a room for the first time. With young patients, I talk about walking in music forward, which means I'm literally walking in with a bag of instruments that are loud and colorful. So it's very clear that I'm there for a different reason. That's a very different approach than how I walk into a room of a teenage patient. I believe that the therapeutic relationship that's created with young adult patients and teenage patients, the music often comes as a result of an established relationship. And so I invest a lot of time in being with young adult and teenage patients before sometimes music is ever introduced. Music therapy has the flexibility of time. I'm able to spend a lot of time at bedside. That's not something that a lot of other professionals here in this hospital have a lot of. So I'd like to carve out a good amount of time in the beginning of our relationship to be with them, to pull a chair up and be bedside, introduce who I am and what music therapy is and looks like here at the hospital, but be very clear that the music is driven by them and that intervention is driven by them. And then I sit back and I wait to see what happens. And oftentimes what happens is the conversation starts with, what kind of music are you listening to? What is your relationship with music? Are you listening to music? Where does it fit in your life? And sometimes the conversation moves into a very different direction. And this gift of time spent outside of music creating a relationship, often results in the disclosure of really important information that impacts outcome and impacts their health. For example, I have been with patients who have disclosed mental health histories that impact their care, that they have otherwise not disclosed to anybody else. I have been with patients who have disclosed profound fear around falling asleep towards the end of the evening that they have not disclosed to anybody else. And I often get a question from nurses of, why are you able to do that? Why are they sharing that with you? And I truly believe that it's the gift of time and the gift of presence. Being a music therapist means not just knowing how to facilitate music in the moment, it also informs how you are with patients. And it's the how you are with patients that I think elicits these incredibly important responses and disclosures from our young adult patients. It's information that is essential for their treatment team to have. Music will often come from that. Often the most powerful music therapy interventions with young adult and teenage patients happen after a disclosure like that. There is an essence of trust and buy-in, and also perhaps even vetting of me, that this is somebody that can hold my information and also gives me these tools of how to be expressive, maybe using music. So in the case of a patient disclosing fear around falling asleep at night, we are incorporating mindfulness and meditation activities for him to use in the evening when there are no other care providers around, to give him some autonomy about how to handle those really distressing hours of falling asleep. And there can be some really profound songwriting, the creation of playlists. What the music looks like is so different from everybody, but what I think is so essential is where it comes from. And it's that time. It's that time that you're spending bedside, really getting to know people and allowing them the space to say what needs to be said, no matter how burdensome and how painful it is to say. And again, I think that's one of the most rewarding parts of this job.
Would you feel if this wasn't real? What if you were here, holding my hand, spending every second with you? But now when I reach for your hand and all I grab is just air, and I guess all I need to say is goodbye to you, goodbye to me. This is the end. until I see you again, until I see you again. You get to see the person I've become. I gave you all my heart to love, and now we don't even speak. So it's time to say it. Goodbye to my heart, my heart. You left me on the ground and opened your wings and went up to the clouds. And I just lie here looking up at you. Come rescue me. Goodbye to you. Goodbye to me. Farewell to us. This is the end until I see you again. Until I see you again. Sitting back, remembering all the things you ever said. Now we know you're not coming home tonight. You left my heart to bleeding. Goodbye to you. Goodbye to me. Farewell to us. This is the end until I see you. Goodbye to you. Goodbye to me. Farewell to us. This is the end until I see you again. Until I see you again. How would you feel if this wasn't real? Just tell me how you feel. Just tell